Today, I'm going to show you everything inside my emergency medical kit. This is not a minimalist kit, not a theoretical kit. This is what I actually prepared based on real use, real failures, and real lessons. In disaster, you don't get perfect conditions, you get pain, infection risk, stress, and limited resources. And if you have a family, you don't have an option to stop. So the first, this is the first. This is basic painkillers, ibuprofen and acetaminophen. I keep a large supply of basic painkillers like ibuprofen and acetaminophen. They're not very strong, but I have a lot of them. It includes 20 tablets inside of this box. They're not very strong, but I have a lot of them. They're for mild colds, light headaches, and early symptoms. Normally, if you feel pain, you should rest. That's the correct choice. But in a disaster, that choice may not exist. You may need to move. You may need to carry supplies. You may need to protect your family. In these situations, even weak pain relief can help you keep functioning. So the second, this is a strong painkillers, loxoprofen. I also keep a small amount of stronger painkillers. It includes loxoprofen. They're expensive and limited but very powerful. They can temporarily suppress extreme pain like severe tooth knob pain or intense menstrual pain. But this is important. If you experience that level of pain in normal life, you should go to a doctor immediately and fix the root cause. This medicine is not a solution. This is a last line of defense. In a disaster, you might suddenly develop serious conditions and medical access may be limited. This is the last resort for that moment. For the next one, this is a petroleum jelly. It protects damaged skin, cracks, dry lips, and minor injuries. I've actually used this when my skin cracked due to low humidity, and it helped reduce pain and support healing. In many regions, dry conditions make skin break easily, and in disasters, nutrition gets worse, less vitamins, less protein, so skin become weaker. This is especially critical if you have babies or small children because their skin barrier is quite weak. Protection is not optional. And fourth, uh, this is a disinfectant. This is for cleaning wounds. A small cut can become a serious infection if ignored, and in worst cases scenario, it can lead to severe complications, even amputation. In disaster situations, hygiene is difficult to maintain, so that's why disinfectant is essential. The fifth one is bandages. This is just normal bandage. It protects injured areas. They prevent further damage and contamination. Sixth item is bandage clips and tape. I also keep these clips and tape to secure bandages. because without them bandages won't stay in place. This is tweezers. Tweezers. They're for removing splinters or debris. Even something small like a splinter can lead to infection if you leave it untreated. Next, next item. This is tourniquet. This is used to stop massive bleeding, especially arterial bleeding. I've never used it in real emergency, but only in training. But if you ever face severe bleeding, this can save a life. Important point, you must tighten your bleeding extremely strongly using this tape. Improper use can be dangerous, so if you plan to carry one, you must learn how to use it properly. It's anti-itchy medication. I keep two types of anti-itchy medications. They are for insect bites and skin irritation. In the disaster conditions, insects increase, and scratching your skin can easily lead to infection. And the next one, my 10th item is this is cooling patches. There are cooling patches you can apply to your skin. They help reduce muscle pain and joint pain. They won't completely fix the problem, but they help control inflammation in the early stage. Especially after heavy labor, this can make a big difference. Next one. 11th item is cough or asthma syrup. I keep this cough and asthma syrup because my family member has asthma. To be honest, I didn't feel strong effects when using it. Asthma is known to be difficult to manage without a proper prescription medication. This one is herbal, so the effect is likely mild, but it can be used for children, which makes this still valuable. Next one. My 12th item is vapor rub made by Vicks. This is a vapor rub applied to, for example, your chest, throat, or back. It helps with congestion and breathing discomfort. In my experience, this worked better than this syrup for easing asthma symptoms. But again, it does not solve the root problem. It just supports. Next one. These items, throat medicine. I keep multiple throat treatments. This is a powder one. It's known really strong effect. Also, liquid iodine solution. Also, this is a liquid type, but a bit flavored for children. The powder type is very well known in Japan, and this is quite effective for throat pain. This helps reduce irritation and inflammation in your throat. 14th item, probiotics. These are powdered probiotics with lactic acid bacteria. The doses can be adjusted so they can be used for children. They don't stop diarrhea instantly, but these help stabilize the gut. In disasters, diet becomes unbalanced, especially low fiber intake. These items lead to the digestive problems, so having this helps. These are eye drops. I have multiple types of eye drops. I keep several types of eye drops. This is cleaning eye drops for dust, pollen, or volcanic ash. Also, this is antibiotics antibiotic eye drops for infections like stys or conjunctivitis. This one is anti-allergy eye drops, and this is eye fatigue relief drops. In disaster conditions, maintaining hygiene is difficult, so eye infections become more likely. I personally experienced strong effects from this anti-allergy eye drops during severe pollen seasons, but over time the effect becomes weaker, so prescription medicine was necessary. This is a nasal spray, like for congestion. I used this when my nose was completely blocked due to severe allergies. It allowed me to breathe through my nose again and sleep properly. Sleep is critical. If you can't sleep, your stress increases and your decision making getting worse. In a disaster, they can be dangerous. So that's all. But what I choose not to stock, I decided not to stock like strong anti-diarrhea medication. In daily life, it's useful, especially in situations where you cannot go to the bathroom immediately, like in train. But in a disaster, the situation is less likely. You can usually, if you want to relieve yourself, just do it. So it's no problem. So I prioritize other items instead. Also, what I was missing, I made some mistakes in my this preparation. First, I ran out of children's cold medicine and forgot to restock it. Many medications cannot be used for infants or young children. This is especially true for painkillers. Giving adult medication to children can cause serious harm, so if you have children, you must carefully check what is safe and what is not. Second, I rely too much on the internet to gain information. In a disaster, you may not have electricity or internet access, so having physical medical books is important, especially guides for treating children. This is not a perfect kit, but it reflects reality. In disasters, small problems escalate. A small cut becomes an infection. A blocked nose becomes sleep deprivation. Pain becomes immobility. And those small failures can put your family at risk. Preparation is not about comfort, it's about staying functional. When everything else breaks, build your kit before you need it.